That was great. When you come to a lot of these conferences like I do, you come back in, you learn a lot of neat things about how people are doing things. You learn a lot. It also keeps you humble. One of the things we heard Lisa say was strategic process improvement. I'm a strategic planner for my organization. I'm also the Master Black Belt in charge of continuous process improvement. It's a natural nexus here. We did that back in 2008. We did that back in 2008, and I thought, yay, you know, we're pretty good tying those things together. She did it 2 years in front of us, so I'm not so proud anymore. She did a great job. In any case, I have a daughter who's 10 years old. She plays soccer. The joy of my life was watching her play soccer. She on a soccer team, lost every game in the fall. Came into the wintertime, and in the winter season, they lost every game. At the end of that season, she came off the field and said, Dad, I don't want to play soccer anymore. You could tell that her heart wasn't in it. They were getting pummeled, and it just wasn't any good. So the parents got together, and they said, listen, we need a new coach. We need to re-engage the team. Because clearly, when a 10-year-old doesn't want to do something that she's obviously good at and Dad likes to see do, you've got a problem there. It's all about leadership. So we got a new coach. Coach all of a sudden engaged the players. Same players, same league. In the spring, they're undefeated. That's what leadership can do for you. And the way they do that is by engagement. The next speaker is Marie Segars. She's a senior vice president, senior VP, and administrator at McLeod Health. And her presentation is going to be engaging the organization.
Well, thank you. Let me just tell you straight up, I'm not a black belt. I don't even have a belt on. So I hope I do have something to share. We have a...
we do. That's right up here.
Okay. If it had been a snake, it would have bit me. So we always start with, you want to know about who we are. I am in a hospital in South Carolina, McLeod Health, a 5-hospital system. We are a private, not-for-profit system. We got about 750 medical staff members across our 5 hospitals, somewhere right around 5,000, 5,500 employees. We own and operate 50 physician practices in and around our area. We have those other things that you would expect a moderate-sized medical center to have. You know, all size is relative. In South Carolina, we're the big hospital in my area. A level 2 trauma center, have a cancer program, a pretty aggressive heart and vascular disease program, large perinatal center because we have lots of low birth weight babies in the South, especially in our part, and we have a residency program, a family medicine residency program. So where did we start on quality? You know, you always want to know where people, where were the roots? In our town is a GE factory that makes MRIs. If you have a GE MRI, it was made in my town in Florence, South Carolina. Jack Welch came to Florence, visited that plant, gave them an award for some quality work they were doing several years ago, came over to our hospital, sat in my chair. Jack Welch's butt has been where my butt is. That's better than black belt. And I'm just kidding. I'm just kidding. What's different about us is we are not a Six Sigma hospital. We adopted the GE problem-solving process, which was a precursor to Six Sigma, and we still today use the PSP process. The reason we did is because it appeals to physicians, nurses, and therapists because it's based on scientific process, much like what we learned in nursing school or in medical school. It was easy for people to grasp at a variety of levels. Now, we have some black belts in our organization who help to guide the process, but we've not adopted all of Six Sigma because we wanted to have a common language of problem solving. We felt like the best learning was done working on real problems, not necessarily always in the classroom, but working on learning as you work. And we had most of our success in the 90s, in the early 90s, about the same time Roger Gerard was talking this morning about Theta Care coming out with lean, we were sort of coming out the gate with clinical effectiveness, and in fact got some national recognition for that. We made some advances in clinical work before, you know, it was really cool to be doing that stuff. The premise around being physician-led, using data to guide us to what our problems are, and then using evidence-based to clarify what would be the best practice we could bring to our patients. And so, you know, we had some success there. The quality triangle, this is our quality triangle. It represents the infrastructure of quality. It's based on a just culture, a culture of a responsibility that, one, you have a responsibility to follow the process. Two, you have a responsibility to report if the process isn't working. And that we don't believe anybody comes to work saying, I think I'll kill a couple of them today. I think I'll make some mistakes. I think I'll deliver the wrong supplies. But that people really want to do a good job and that we can trust them to do that. We base one of our building blocks is on leadership support, and that's what I'm going to talk the most about. And then physician leadership. We believe that physicians have to be partners in any improvement, that you can't do it for them because they are leaders in and of themselves. You can't do it to them because they will rebel. And third, they know what the answers are if we just open up a way for them to participate in the problem solving. We believe quality of safety is the next place. In other words, you know, when somebody comes to your hospital, they expect that you won't hurt them, that you won't harm them, that you would do things that would be safe for them. The quality of science, bringing evidence-based medicine to the bedside. We know that the literature says that something new and innovative in clinical work today takes 15 years to get to the bedside. We think we could probably do that better if we